Webcast coverage of the Minnesota House of Representatives is brought to you as a public service by House Public Information Services.
Good morning. My name is Elliot Seid, and I'm Director of AFSCME Council 5. We're a union of 43,000 public and nonprofit workers throughout Minnesota. Like most Minnesotans, most AFSCME members have health insurance, but we're tired of paying more for less coverage. Our biggest problem isn't access to care. It's access to affordable, quality care. That's why we support the health care reform bills that are moving through the House and Senate. Today we pay doctors for treating patients who are already sick. The legislation will reform the state's payment system to reward doctors for preventing illness. By paying for healthier outcomes, the legislature can contain costs, but it takes money to save money by reforming the payment system. Instead, Governor Pawlenty wants to use our health care reform dollars to balance the budget. He promised that he wouldn't raid the Health Care Access Fund, but now he's breaking that promise. Sick people contributed to the fund by paying their medical bills, and it's simply unethical to use their money to patch potholes. We have a rainy day reserve to plug the deficit. The sick tax should be used to make people healthy. Affordable health care is a necessity. It's not a luxury item that can wait until state coffers are full. Our union is asking Governor Pawlenty and state legislators to contain costs so nobody has to spend more than 5% of their gross household income for out-of-pocket costs for health care. Today, many Minnesotans are paying more than 5% of their income on health. In fact, 1.1 million Minnesotans can expect to pay more than 10% of their income for health care in 2008. That's according to a recent report by Families USA. We know this is a tough budget year. Nobody knows that better than we do. But now is the time to lay a strong foundation for reform to make health care affordable for all Minnesotans. Governor Pawlenty needs to seize this opportunity. Thank you.
And I wanted to thank all the speakers and just let you know who else is in attendance here. It's Kristen Beckman and the SEIU is represented here today, the Children's Defense Fund, the Minnesota Nurses Association, the AARP, ALINA, and we have some letters of support as well attached from the Minnesota Medical Association, Park Nicollet. So it is a broad coalition of folks. And I think the message is clear. It's about the urgency of fixing this problem this year, that we need to get it done this year, and that we're all committed both within the Capitol and outside the Capitol to having that happen. Thanks. If there's any questions, we can do that.
When will this be on the floor?
Probably 2 weeks. Right now we're in the it'll be heard in the Finance Committee on Monday. And then it goes to, I believe, the Ways and Means.
Governor Pawlenty in his press conference yesterday spoke about the possibility of some kind of compromise. Do you see an opportunity for compromise that allows the governor to tap the Health Care Access Fund for other purposes without doing severe damage to your package?
I think that the Health Care Access Fund is intended to provide health care to Minnesotans, and I think we are committed to making sure that that's what it's used for, and to do the kind of comprehensive reform that both gets after cutting costs but also making affordable coverage accessible to all Minnesotans. We're going to need to use those dollars for the purposes they're intended for, which is giving people coverage, health care coverage.
So you would not accept at all any money from the Access Fund going for other purposes?
I think no would be the answer right now. Yeah, that would
but
be the
you might change.
What?
But you might change.
That our position is that we're going to use the Health Care Access Fund for health care purposes and for covering people.
So how do you bridge it between the governor and what the proposal is to make it work?
Well, he wants to have health care reform. He certainly supports, we've had many discussions. He does support most of the payment reform things in the bill. He is concerned about the budget, like the rest of us are, but I think the state's concern for health care will allow us to reach a compromise with the governor and get this done this year.
Are you trying to find a time to meet with him? Are you asking for a meeting? Is he open to meetings on this? How do you reach this compromise?
We've met many times with the governor on this session, and the speaker and the majority leader in the Senate met with him, I think 2 days ago, and this was the main topic of discussion. So there's communication going back and forth.
So is it out of your hands and the leadership's hands now?
Well, we have to, in the House, we have to pass a bill off the floor and get it to conference committee. And at that point, I think we could work out the differences with the Senate and the differences with the governor. I'm committed personally to getting a bill passed this year and signed by the governor.
And how will your bill differ from what the Senate passed?
To repeat
How will your bill differ from the Senate's bill?
Well, it's hard to say since I haven't read their bill. I've been too busy, but there were some amendments I know that went on yesterday that make the bill similar to where we're headed. And so I think there will be some differences, but the overall thrust will be the same in both the Senate and the House bill.
So there's no big stumbling blocks between the two chambers, as far as you know?
No.
Okay, so the stumbling block is, as Ashley said, the governor?
Well, he is the governor. You know, he has to sign a bill, and we're certainly on this bill. I doubt if we could override a veto. He has a role to play, and he is, as I said, the governor, and I acknowledge that. That means he has to be part of the deal.
But this is a big important part of the process for you to get it passed. What do you have to do to get the governor to be on board and make the bill pass?
It seems to me that focusing just on what's happening between the Senate and the House and the governor is only part of the picture here. And I think one of the reasons we wanted to have this press conference today is that there's a lot of other parties involved in this discussion, and we kind of lose sight of that often when we're here at the Capitol. And so I think this is going to be a broader discussion among all Minnesotans and a lot of the folks that are represented here, as well as leadership and healthcare folks and other legislators and the governor's office going forward. So I think that there's a lot of ways that we can work through these issues, and there's a lot of people who are interested in making sure that that happens. And so I don't think that there's any particular details right now that you could point to say if we do this and this and this, that's going to make the difference. But I think everybody, including the governor, as well as legislators in both bodies and a broad swath of legislators, as well as the public, is interested in getting this done now. And you know, it's the legislative process. We have to work and discuss, and we have been talking with folks on both sides of the aisle and outside these walls to make sure that we can accommodate people's concerns as far as possible while moving forward on what has to be bold reform. I mean, there's a lot of concern about and uncertainty about the proposal that's going forward, but I would say what people aren't uncertain about is that we have a broken healthcare system right now, and we need to fix it. And I think that's where the momentum is coming from. And with that momentum, I think we can get this done. Thank you.